This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Orofer FCM Injection is an effective treatment for iron deficiency anemia. It contains ferric carboxymaltose, designed for patients who cannot take oral iron supplements. Indications and uses. This injection is primarily used to manage iron deficiency anemia in adults and adolescents over 14 years of age. It is particularly useful for patients who are intolerant to oral iron supplements, have chronic kidney disease, or require rapid iron replenishment. How it works. Orofer FCM injection works by releasing iron from its complex, which then aids in the production of hemoglobin and increases the red blood cell count. Directions for use. The injection will be administered by a healthcare professional through an intravenous line. The physician will determine the appropriate dosage and duration based on the patient's age, weight, and severity of anemia. It is crucial to follow their guidance closely for optimal results. Possible side effects. Potential side effects may include headaches, dizziness, flushing, nausea, and reactions at the injection site. If any symptoms worsen, it's important to consult a physician. Precautions and warnings. Before receiving the injection, inform your healthcare provider if you are pregnant, breastfeeding, or have a history of severe allergic reactions. Caution is advised for those with chronic kidney or liver conditions. FAQs. 1. What is the use of this injection? It is used to correct iron deficiency anemia in adults and adolescents over 14. 2. How long does it take to improve hemoglobin levels? Improvements may be noticed within a few days, but it can take weeks for full effects. 3. Are there common side effects? Yes, including headaches and nausea. 4. Can it be used during pregnancy? Caution is advised, and you should consult your doctor. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below.